So I want to talk briefly about side effects. We touched on the importance of supportive care before we went into some of the details, but I want to just go a little bit more in depth into that. Side effects can vary according to the type of cancer therapy. So it's not something that I can speak to in a lot of detail because it's going to be different for each person and different depending on the specific medications that are being used. But I wanted to give you some broad categories of common side effects and to really emphasize that the most important thing to do is to report any side effects to your healthcare team because we actually have strategies available to manage the vast majority of them, and we really do want to hear about it and help you to feel better and to get through the treatment feeling as well as possible. So each box that I have on this slide goes through some of the general categories. So from a gastrointestinal standpoint, diarrhea can be pretty common, as can nausea or mouth sores. From a hematologic or blood perspective, we often see low blood cell counts, and that can result in an anemia, which can cause fatigue or dizziness sometimes, low platelets, which occasionally predisposes to bleeding, and low white blood cells. And since those are the cells that fight infections, that can lead to fevers and infections. Some of the medications affect the heart, and so sometimes we need to monitor the heart to make sure the muscle is not weak, and we need to monitor the electrocardiogram to make sure that the rhythm is not abnormal. The nervous system can be affected also, and that can most often lead to numbness and tingling, typically in the fingers or toes. And sometimes people report some cognitive changes or what is often referred to as chemo brain, which is trouble with concentrating or focusing or memory. Skin changes are also very common. The most well-known, obviously, is hair loss, but rashes often occur from time to time. And in general, fatigue or abnormalities in some of the blood tests are not uncommon. So just to emphasize, really reporting these to your healthcare team is really the most important way to be proactive about them.